Let's talk about some of these new reports about the projected death tolls and how it may be worse than what the president and some others had said recently, and what can be done to slow the spread of COVID. Laurie Garrett is a Pulitzer Prize-winning science journalist and writer whose career has been devoted to tracking and reporting on infectious diseases. Laurie Garrett, thank you so much for joining us. We do have these apparently two new grim forecast today. I want to ask you about the CDC report yet. We haven't seen all the numbers. The White House is saying it's not their numbers, but they are talking about by June 1st, 3,000 deaths a day. They're talking about up to 200,000 new cases a day. This is the wrong direction.
Absolutely, Judy, and it's a huge explosive growth they're predicting. And it's basically, if you look at the distribution that they're imagining, it's really the prairie states, the sort of Mississippi Valley, and the deep South states. And it seems, I think, though we don't have access to the raw data that they're working with, but it does seem to coincide with these outbreaks that have been occurring inside of meatpacking plants, nursing homes, Veterans Administration hospitals that have claimed large numbers of workers in those facilities, but haven't yet generalized into the larger community. And I think they're projecting that there will be generalization, that a typical, an infected meat packer, for example, might then infect their family members. Some of those family members may infect local storekeepers and so on. So I think they're imagining a pretty explosive set of growths, all in fairly small, remote areas, and in many cases, rural counties.
And do you think it's the same explanation for this new model that we're told is coming today from the University of Washington, where they're projecting the total number of deaths in the U.S. at 135,000, way beyond what it was before? Is your reading of it same factors at work here?
Again, we haven't been given a lot of the details that are used for the analyses yet. But yes, I think they're also looking at higher than expected new infections and deaths in this swath of states that is the Mississippi Valley region all the way up to the Canadian border.
I want to ask you to listen to some things that we've heard from President Trump in recent weeks, and ask you a question coming out of that. Let's listen.
The data suggests that nationwide we have passed the peak on new cases. A minimum, if we did nothing, would have been 1.6. If you cut that in half, you're talking about 800,000, 900,000, a million people dying. But we did a lot of work, and I think right now we're heading at probably around 60, maybe 65,000.
I think we've done a great job. As you know, minimal numbers were going to be 100,000 people. Minimal numbers were going to be 100,000 people, and we're going to be hopefully far below that.
And Laurie, I think a lot of people want to know, how is it that these projections could have been so off if it turns out to be these new numbers are right?
Well, first of all, this is not a stagnant situation. We have been trying to respond to the virus. So measures have been taken in various key states, New York, Washington State, California, Massachusetts, taking very strong steps to try and mitigate the spread by having people go into lockdown. Conversely, we have a number of states that have decided to actually back off. The state of Ohio today just said that the governor wants companies to be required to report the names of workers who don't go to the jobs as they open up. So that's the government demanding that you must risk your life. You must go into a meatpacking plant. You must go onto a job site. So we have a lot of actions being taken that make the situation quite fluid. And whatever the snapshot of a moment is that you make your projections off of is by definition going to be a different snapshot tomorrow and a different one the next day.
They're working, and yet the picture is more complicated than that. What is the message then, Laurie Garrett, to the American people from all this? That clearly that they need to continue to practice the social distancing, hand washing, just the basic elements that we have been practicing. But what more can Americans be doing?
Well, I think at this point, if I were the governor of any of these states that is projected to see significant increases, I would be ordering a lot of testing that is targeted to give me some policy guidance. I would test in meatpacking plants. I would test in school settings if there are schools still open, every nursing home, every assisted living center, any place where I still have people co-housed, Veterans Administration centers. And I would want to know, do I have a trend day by day that shows increased transmission? And if I do, then that's a targeted community. That's where I direct my resources. I have to solve this problem immediately. If we don't take smart steps, guide our testing in wise ways, then we're just going to be flailing around, racing behind the virus, which will be consistently, Judy, way ahead of us.
And one other thing, Laura Garrett, you have said for a long time that Americans have never sufficiently invested in public health, and that's what's underlying so much of this.
Absolutely. I mean, just look at one of the key markers that indicates whether or not you as an individual are likely to have a severe outcome if infected and potentially succumb to COVID disease is hypertension. Well, hypertension is the cheapest, easiest intervention imaginable. You know, just slap the cuff on, check your blood pressure. And we have a raft of medications that will help you. We know how to bring down high blood pressure. That is a perfect marker for lack of access to consistent public health interventions and medical care. And when you look at the racial distribution and the class distribution on who is dying right now across America of COVID-19, you can see it is exactly the same as who's not getting treated for their hypertension, who's not getting appropriate basic health interventions on an ongoing basis. But a huge percentage of America has no consistent health care, doesn't have a doctor by name. A situation, a crisis of this scale hits, they have nowhere to turn. That we have a patchwork mosaic of public health systems, a patchwork mosaic of guidances and government responses. You cross a county line and it's a whole different ballgame. This is not the way to stop a national epidemic. This is chaos.
Well, no question, a lot of us are so much more fortunate than many, many other Americans. Laura Garrett, thank you so much for putting it in perspective. Science journalist and writer Laura Garrett, thank you.
Thank you, Judy.